Arthritis is the leading cause of disability in the United States. What if I told you your arthritis may be because of your metabolic health? Please allow me to explain. My name is Dr. Ennin, doctorate pharmacist and a functional medicine doctor. And again, welcome to the channel. Today, we are going to be talking about arthritis, specifically osteoarthritis with respect to our metabolic health. We have always thought of osteoarthritis as a wear and tear syndrome where we have overused our joint. But emerging research is pointing to the direction of metabolic health. We have always thought of metabolic health implicated in diabetes, in hypertension, and even cancer. But emerging research is pointing out to the direction of metabolic health as a reason for joint health, specifically osteoarthritis. See, the research is now saying that if you have osteoarthritis, we should be exercising more. The research is also saying that if you have osteoarthritis, we should go low on the carbohydrate to support our metabolic health and in turn affect our joint health. Now, the research also stating that our body weight and our body weight loss is independently associated with poor joint health. Now, when we think about metabolic health, we have always thought of that in cases like diabetes, hypertension, and cancer, as I did mention earlier. But this association with body weight and body loss all boils down to one thing, and it's a hormone, and that hormone is leptin. Yes, leptin. We have always known leptin to be the satiety hormone. So leptin is when we eat, our body releases leptin and it tells us that we are full. So leptin is released from our fat cells. So it is fair to think that once somebody is obese, once somebody is overweight, they will have more leptin. And for that reason, they'll be fuller faster. But unfortunately, that is not the case with people who are obese or who are overweight, because people who are overweight tend to be leptin resistant. So in these people, they tend to release a lot more leptin, but their body is unable to sense the leptin because they have leptin resistance. So they keep eating away. Now, the research is pointing to the direction that leptin, which was once known to be a satiety hormone, is not just a satiety hormone, but a pro-inflammatory hormone. So when you have high levels of leptin, it causes a lot of inflammation throughout the body. The research is suggesting that when people lose weight, their pain, their osteoarthritis pain goes down. And that can really be fascinating simply from the standpoint of this. See, we have thought of osteoarthritis as a joint issue, as a wear and tear. So if it is wear and tear, which is really more like a permanent issue with our joint, then when we lose weight, it shouldn't change anything. But when people lose weight, their pain goes down. So what it's telling us is that once we lose weight, we lose leptin. And leptin is implicated in this condition by producing a lot of inflammatory cascades. So by reducing weight and reduce leptin, the pain goes down. So it makes sense for it to go down if it is coming from a metabolic perspective. So the new science, the new research is pointing to the fact that osteoarthritis is not a wear and tear issue. It's rather a metabolic issue. So what are some of the ways we can do to mitigate leptin? The first one is to exercise or walk more. Research in 2021 states that by walking between 8,000 and 12,000 steps a day, people were able to see reduction in joint pain and lower back pain. So the second thing to do is to balance our carbohydrate. Yes, balance our carbohydrate, because if we are sedentary, if we are not moving more, then we want to reduce our carbohydrate intake so that we will be able to reduce our leptin levels. Keep in mind, leptin, glucose, and insulin are all parallel to each other. So when you bring leptin levels down, you bring insulin down and you bring glucose down. And one of the ways to do that is to go low on the carbohydrates. The third thing is to incorporate some type of fasting, intermittent fasting. I like to see between 16 to 18 hours where we don't eat anything but just drink water in between that time span. So usually in clinical practice, I like to see people eat their first meal at noon and their last meal by 6 p.m. This gives us 16 to 18 hours without food, and that helps brings down leptin, brings down glucose, and brings down insulin. Keep in mind, glucose and insulin are all very inflammatory to the body. So by doing that, we bring that down. The last thing I want to talk about is resistance training. By doing resistance training 3 to 4 times a week, we are able to bring our leptin levels down. And last piece I want to talk about is testing. There is a range between 0.3 to up to 15.2 for both men and women. And that's the range we want to be. That's the reference range. Anything beyond 20 nanograms per ml can be very inflammatory and can cause a lot of problems for our joints. So if you have osteoarthritis, on your next lab, you want your doctor to test your leptin levels. Anything greater than 20 nanograms per ml could be the reason why you have the joint pain. And this is another pearl of health wisdom. If you like this content, please don't forget to like, please don't forget to follow, and please don't forget to share. And most importantly, don't forget to subscribe so that we can keep this conversation going. I will see you in the next video. Thank you.